Hypocalcemia in dairy herds, the prevalence, risk factors, consequences, monitoring, and prevention. Hypocalcemia in dairy herds, the prevalence, risk factors, consequences, monitoring, and prevention. For the prevalence, there's a high variation between farms. However, it should be less than 10% of fresh cows. The risk factors are increased age, increased amount of births, increased milk production, and Holstein Friesians, as well as decreased dry matter intake and decreased calcium intake, and decreased calcium absorption due to decreased vitamin D, or decreased calcium mobilization from the bones due to decreased PTH regulation. This is due to improper preparation before birth. It occurs due to hypomagnesemia in the periparturient phase, which is before birth. The consequences are Downer cow syndrome, which causes decreased muscle function. There's an increased chance of left displaced abomasum, ketosis, mastitis, and decreased reproduction and decreased milk production, and they're more likely to have to be culled. To monitor this, you need to have blood ionized calcium, it's best, in the first 2 days of milking. In the cow's blood, you can test calcium, sodium, potassium chloride, and the anion gap. In the lab results, you can test the total calcium. When doing a farm visit, check the nutrition and management risk. For prevention, monitor the blood calcium and the total calcium. It is to have a total calcium above 2.1 millimoles per litre and an ICA above 1.05 millimoles per litre. It's best to give increased calcium after birth as a bolus, as well as vitamin D, and you also want to decrease calcium before birth. This helps better mobilize the calcium after calving. Also need proper magnesium intake before birth. This is for optimal PTH function. So you want a low dietary cation-anion difference, so high anions before birth.